waiting to go live. Wherever you are, welcome to Let's Talk with Pastor Ngwaru show. On this channel or on this show, we address issues of marriage, we touch family life, we touch life in general. We also cover issues of leadership, development, spirituality, and religion. We also touch elements of health. And this is why tonight we are basically touching a very, very important subject to men as well as to families. And this is about cancers that attack men only. Cancers that attack men only. We are also, if we have any time reserved, we are also going to be looking at other common cancers to men. But basically, our first half, we are looking at cancers that affect men. I wish you can give them all the attention because knowledge is power. So whether you are a woman, a daughter, a wife, or an aunt, it doesn't matter who you are. Take time to listen to some of these with the men in the house over there. And as usual, we give time to our viewers to send in their questions and their comments. And tonight we are going to do it slightly different because it's just the two of us in the studio. We are not going to wait until after 45 minutes for you to start asking questions. You can start questions as we begin, and we'll be able to address them right away. We may not have all the time to address comments, but we'll make every effort to make sure that we address the questions that are coming through. And to help me go through this discussion, I have a health expert by the name Dr. Alex Laguno. I would like to ask Alex to self-introduce, tell us his qualifications, and also tell us his medical history or maybe experience. It's very important in a minute to know exactly who is going to be answering our questions and what qualifications do they hold to answer those questions. Alex, welcome to the program. Alex, if you can introduce yourself, I'll appreciate that.
Thank you so much, Pastor Ngwaru, and thank you for the opportunity that you have given me to be able to speak to your audience and to be able to be part of your wonderful program, public service in many ways, helping the community and also individuals. I actually have finished my medicine in the Philippines, and I took my specialty in internal medicine. And I have been working here in Africa actually since 1982. And up to now, I have worked in several places in Tanzania, in Kenya, Zambia, then Zimbabwe, and also in Botswana. And in 2003, I was called to the Southern Africa Indian Ocean Division to be the Health Ministry's director.
Director of the
starting 2016, then I was also appointed as the executive director of the Adventist AIDS International Ministry. With the health ministries of the church, our focus really is having good health and especially prevention. And I have been really associated with the Cancer Association when I was really in Botswana. I worked with the Cancer Association in Botswana, and they in fact sent me to the World Health Organization Framework for Tobacco Prevention. That was in Nairobi. And we were actually the ones who helped draft what we call the Framework for Tobacco Law. You see, the law was passed in Botswana. And we are so happy, you see, that we were able to achieve that, because you see, if there is number one factor that really is preventable in health and also especially in cancer, it is stop smoking, and we will discuss that.
Yeah, we'll talk about that. Yes. Yes, I really appreciate Dr. Laguno, your expertise, your experience in the medical world, your engagement at government level and other entities and whatever. We can see that you are a very resourceful person, and I am sure my audience is going to benefit a lot from your experience and whatever. We try by all means on this channel to invite people that are experts in a particular field so that our people, most of them don't quite get the chance of meeting experts. But in this program, we try to make sure that we cause the public and experts to actually meet. Now, talking about cancer that attack men in particular, and before we identify those cancers, I am sure somebody at home is trying to say, what exactly is cancer and how does it affect health?
Okay, we just hear people say about cancer or CA. That is actually the shortcut for cancer,
Mhm.
and people have various what we call conceptions of cancer. But really, when you say cancer, it means that there is an abnormal cell, there is a growth,
Mhm.
or what we call the appearance of abnormal cells. An
Okay.
example, for instance, is the lungs. Okay. Now,
Yes.
the function of the lung is for you to be able to have oxygenation. So the
Yes.
normal cell, the alveolar cell, the
Yes.
function there is so that you'd be able to have oxygen to the different parts of the body. Or like for
Okay.
instance, in the case of the stomach there is to also help digest food. Okay, the
Mhm.
stomach cell, because all of
Yes.
us are made out of cell. But what happens in cancer is that the normal cell abnormal cell.
Yes.
So if it is going to be replaced by an abnormal cell, for instance, in the lung, and it
Yes.
is able to facilitate oxygenation, or in the
Yes.
case of the stomach, to be able to digest, or in the
Yes.
case of blood, to be able to bring nutrition, yet
Yes.
because it's an abnormal cell, then
Mhm.
it fails
Yes.
actually to do its normal function.
It's normal function. Yes.
And as a result, then your health is going to be compromised. Now, for instance, if
Mm.
your cells in the lung cannot anymore deliver
Yeah.
oxygen, that means that
Yes.
you are going to die. And that is
Yes.
really the end result of actually cancer, because in
Yes.
the end, the normal cells are going to be replaced by an abnormal cell, and
Mm.
the abnormal cell is not able to do its function that it was created for. Not
Okay.
only that, but the problem there is that it is also going to grow. What
Yeah.
another characteristic of cancer is that it is going to grow. You see,
Yes.
that is what we call a characteristic of abnormal or proliferation. It does not
Yes.
stop. Like, for
Mm.
instance, in the case of your lips, when you
Yes.
have actually a cut on your lip, what
Yes.
happens when it heals? It is going to stop, or else your lips is going to become so big. That is
Yes.
how God has made us. But in the
Yes.
case of cancer cells, there is going to be no what we call stopping of the growth. So later on, the abnormal cell is going to become a tumor. So
Mhm.
cancer is associated with tumor. Not
Yes.
only that, but the sad thing is that it is going to spread to other organs. And that
Yes.
is when you call what we call metastasis.
Okay.
Metastasis is when the cancer cells actually are going to be transported in other parts of your body. Like, for instance, from the stomach, it goes into your lungs, or it goes into your brain, it goes into your bones. So those are the
Mm.
three characteristics. Number one, abnormal. Number two,
Abnormal.
proliferation of growth. And number
Yes.
three, tumor. Not only that, but what we call metastasis.
Okay. No, no, I get that. Now, let me ask you, maybe on behalf of my viewers there, when somebody is diagnosed of cancer, some people go into depression, and some people go into worry, and it becomes a big challenge. It's a big scare. When I'm told I've got toothache, I I I don't lose sleep over that. When I have a headache, I don't lose sleep over that. But if I should be told that, look, you have cancer, people, others may actually become psychotic and what. Why is cancer so much of a scare? from
Okay.
your observation? Yes.
Number one, actually, we have to realize that it is very important to catch cancer at an early stage, because if you catch cancer at an early stage, it can
Mm.
be cured. It can be
Yes.
stopped, actually. So
Yes.
it is not really altogether bad news. But what is important is that it is going to be caught early. The
Yes.
reason why people are actually scared, you say about toothache, well, it's because there are actually drugs. You say you go
Yeah.
to the doctor, no problem, there is something that we can do about it. But when it
Yes.
comes to cancer, if you are actually caught at an early stage,
Yes.
then your prognosis, or what we call the outcome, is much better. And as I said, you can in fact be cured if it is in an
Mhm.
early stage. I have
Yes.
several patients that have actually caught cancer at a very early stage,
Yes.
especially what we call cervical cancer in women, and they're
Yes.
actually living normal lives because they were caught
Yes.
early. But the problem is that if it is caught at a later stage,
Yes.
number two, you mentioned about toothache. Well,
Yes.
toothache is because there are drugs,
Yeah.
and the drugs are cheap.
Yeah.
The
That.
problem with cancer is that right now there are drugs, okay? But
Mhm.
many of these drugs are what we call very expensive, and
Yes.
many of these drugs are still on what we call their experimental stage.
Hmm.
So that's the reason why it actually is going to cause some problem, some apprehension in you, because you don't know what is going to happen. When you
Hmm.
when you say you have a toothache, then you know what is the outcome. But when you have
Yes.
cancer, you don't know the outcome. And I tell you, these drugs are very expensive,
Mm.
especially if this cancer is at a later stage.
At a later stage, yes. Dr. Laguno, I know my viewers are dying to hear the cancers that attack men. I will soon get there, but before we get there, I want to hold them a bit because I want clarification on something. Cancer stages, whether it is in women or whether it is in men, I have heard of stage one, stage two, stage three. And when they talk of stage four, it's like, man, you are done. What are these things called cancer stages?
Let me just sidetrack first before you say the apprehension, and also you see when you are going to talk about toothache, you are
Yeah,
not you think you're not going to die, but when
yeah,
you are going to have cancer, then you immediately think about death, because that is really special. Now, when it
yeah,
comes to staging, okay, now
yeah,
that is already what we call the doctors, because we have terms so that we would know the
yeah,
reason why we have staging is number one. So we
yes.
will tell you what is the outcome. If you
Mm-hmm.
have what we call stage zero, or
Yes,
carcinoma in situ, or that means
yes,
that cancer is only starting. Okay,
yes.
so you can actually have stage zero, stage one, stage three, stage four, and the
Mm-hmm.
most virulent is when you reach stage four. That
Yes.
means it has already metastasized, meaning
It has
it has
spread right
already
through the body.
gone to the different parts of the body. For instance, okay, now let us go, for instance, in the case of, uh, let us say, just say, for instance, testicular cancer, which we're going to
Yeah.
discuss right now,
To
okay?
discuss here.
When when we diagnose testicular cancer at the early stage, all we have to do is do surgery and remove it. But
Yes.
if you are not going to have it diagnosed at an early stage,
At an early stage, yes.
it can go, number one, to your bladder. That means
Mm.
you would have difficulty in passing urine. You
Yes.
see? And not only that, but it is going to go into your bones. So that
Exactly.
is really what we call stage four. Once it actually goes out of its what we call domain, or what we call where the organ is located, it goes to the
Yes.
other organs,
Yes.
then that is already considered to be stage four. And that
Yes.
is more difficult to treat. Not only that, but the chances of survival
Yes.
is already lowered compared to if we catch
It
cancer when it
is.
is just starting. So, one of the reasons why we have this talk is number one, what
Yes.
can we do to prevent? And number
Yes.
two, what can we do to be able to recognize cancer at an early stage? Okay.
Okay, no thanks. We have a question on the screen there, and it says it's from Nathan, and Nathan is saying, "Thank you for this interesting topic. are there special medical screening processes that detect cancer, or any medical screening will pick that you have cancer? Before we go into specific examples of our penile cancer and the prostate cancer and what in general, what are the screening processes, or we may have to wait until we cover our cancers that attack men? Maybe we can answer this question then. What's your take on this?
Well, there is no what we call a general test. You see, there is no such thing because each cancer is different.
It's a specific, yes.
It has to be a specific test to be able to determine, you see, a cancer. It would give us, for instance, some clue, you see. Like, for instance, when you have a general inflammation, like when you have cancer, there is what we call a general inflammation. And when you have a general inflammation, it gives you an idea that there is something wrong going on.
Yes.
Like, for instance, okay, I had a patient who came to me, and she was only suffering from an elbow pain, joint pain. I have been going to different doctors, and it has been 7 months already, and nobody can actually pinpoint what is wrong with me.
Yes.
So what I did what they call a general test, just to tell you that there is something abnormal that is happening in your body.
Yes.
I did what we call an erythrocyte sedimentation rate, ESR, which is very cheap.
Yes.
And then I found out that it is abnormal, okay? Now, when you have ESR, it doesn't mean it's only cancer. It can mean actually autoimmune disease. It can mean infection. It can mean TB. But it gave me an idea that there was something wrong with her. So, but then I was suspecting, then you think about the common cancers. And she was a lady, so I said, did you have actually a cervical pap smear? And she said, no. You see, I had a whole series to think about because there was an abnormality in her blood.
Yes.
But I immediately thought maybe a common cancer would actually address the issue. And sure enough, she said, I did not have. And when we did actually an examination, of her, she had actually cervical cancer, stage 4 already, you see.
Oh, stage 4 already.
There is no what we call a specific test that you tell you about cancer, because all of these cancers have what we call, each cancer have their specific test that you can actually identify.
Okay. No, I appreciate that. Now, doctor, can you now tell us, just give us a listing, maybe without explaining, we'll go into the explanation later. What cancers are specific to men?
Okay, cancer specific, because you see, our anatomy is different than women. And as a result, the anatomy, as I said, all of our body has different cells. So in men, you have actually prostate cancer, specific for men. And then testicular cancer, which is only K. And number 3, what we call penile cancer. But there is also the most common cancer in men, which is lung cancer, you see? Lung cancer is very common in men. But anyways, since our topic is more for cancer specific for men, then let us discuss about this first.
Okay. No, that's fine. Now, let's go straight into our business for tonight. I'll start with penile cancer, and I suppose it's coming from the penis. That's where it is deriving its name. Am I right, Doc?
Yes, you're right. Yes.
Yes. Now, so tell us, how does this cancer present itself? How does it present itself? We want to look at signs. We want to look at the complication that comes with a delayed treatment, as it were, or diagnosis, and also look at prevention. So we're going to be looking at these cancers one by one, and we want to take them through. Now, let's look at, first of all, in its worst case scenario, the penile cancer. How does it present itself?
Okay, I hope you men know where your penis is, okay? And since our wives are also watching, because you see, it's very also important that, sometimes men do not find it themselves. And then also women can actually help. And this is the reason why you have already also invited wives to come in so that
Yes.
they would also be of assistance. Okay,
Yeah.
one of the things that we can actually find, okay, now, penile cancer, number one, like for instance, the skin, you can actually have a change in the color of the skin. Okay,
Mm-hmm.
you can have an ulcer, you can have a lump, or the skin actually
Yes.
becomes bluish, and there is
Yes.
going to be what we call a foul discharge. Now, when the
Mm-hmm.
foul discharge comes, that means that the cancer is really starting from inside. Okay?
Mm-hmm.
Not only that, but you see, for the men, if you are going to penis, you have actually the skin which you can retract, and what comes out is the head of the penis, which is called the glans. You see,
Yes.
and this is it. There could be also swelling. There could be
Yes.
a lump, and also you feel the inguinal area. Now, if you
Yes.
feel the inguinal area and you have some nodes coming out, that means it has already metastasized.
Yes.
So those are the ones. Change in color. Okay, number one, change in color.
Yeah. Of the
Ulcer,
penny.
thickening of the skin. You see, a lump, for instance. Okay, those are actually quite common manifestations of what we call this penile cancer, and some of
While
them.
you are there, yeah. While you are there, I just want to get an idea of when you say change of color. Is it in the gland itself, the head of the penis, or you are talking of the covering, the skin that covers the whole penile organ? What changes color here?
It can be in the skin. Okay, what we call that is what we call the prepuce. Okay,
Yes.
it's called prepuce. Okay,
Yes.
and then it could also be in the glands, and it could also be in the shaft. You see,
Yes.
so any of those areas, changes in the color, changes, thickening of the skin, there's going to be a lump or there's going to be a small growth. See,
Yes.
those are signs.
Yeah. Okay. Let's look at what exactly causes penile cancer. What causes it? What are the risk factors associated with it?
Okay, one of the risk factors really they have actually noticed, you see, that it's very important that you do circumcision. And now we
Hmm.
have actually a basis, a biblical basis, when
Yes.
actually God ordered the Israelites as a sign that they
Yes.
should do what we call circumcision.
Hmm.
And they found out that men who actually are going to undergo circumcision
Hmm.
have actually a 67% less
Yes.
chance of developing cancer of the penis. So now you can see that the
Yes.
Bible injunction there actually helps.
Oh,
Part of
that's
the
good.
reason for that is because when you have the foreskin, you actually have what we call these secretions called smegma, this white
Yeah.
stuff.
Yeah.
Okay, that
Yeah.
is where it can easily grow the cancer or what we call uh, the human population. I'm going to discuss about that. Okay, but that is one way that you can actually prevent. But before going into that, let me just discuss when you say cancer,
Yes.
you have what we call risk factors. Risk
Hmm.
factors are not necessarily the one that is causing the cancer.
Oh,
There is a
okay. Yeah.
difference between cause and what we call risk factors. When you
Hmm.
say risk factors, it does not necessarily mean that it is the cause, but it
Yes.
contributes for
It
you to have a
contributes.
chance of having the disease. Okay.
Yes.
Now,
Hmm.
for instance, an example of the risk factor is, for instance, if you are walking on the side of the road, what is your risk factor of being hit by a car? Maybe it's one. But if
Yeah.
you're going to cross the street,
Ooh,
you have
it's a high.
actually more chances of being hit. So you say, okay, for a person who is just walking, maybe it's one. But
Hmm.
for a person who is going to be crossing the street, it is going to be 5 times. It
Yes.
does not mean that it is the cause. It is a
Yeah.
contributing factor. And that is what we do in cancer. We say a risk factor, you see?
Yes.
So
Yes. Yes.
when you have circumcision, it decreases your risk factor, okay? Now,
Yes. Yes.
one of the things that they have found out, okay,
Hmm.
penile cancer is preventable.
Yes. It's
See?
preventable.
Number one, by doing actually circumcision. Number two,
Yes.
they have found out, you see, that the one of the cause of high risk is because of human papilloma virus.
Virus,
Okay,
yes.
human
HPV,
papilloma, yeah, HPV. This is
yes.
also the one that can cause what we call cervical cancer. It can
Yes.
cause anal cancer. It can
Hmm.
also cause throat cancer. It can cause
Yes.
also cancer of your sinuses and nose. You see,
Hmm.
and in some places, what they're actually what we call endorsing is that men should also get what we call this vaccine, because
Yes.
women these days are getting a vaccine that would prevent them from getting what we call cervical cancer. And
Yes.
so some places they are saying, why don't we also give to men? But you see,
Uh-huh.
the more sexual partners you have, the more you
Yeah.
get exposed to HPV. And they found out that about 63% of
Yeah.
penile cancers can
Yeah.
actually be prevented just by being careful of human papilloma virus. Okay, but
Mm-hmm.
for instance, okay, smoking to increases your risk of having what we call penile cancer. And
Hmm.
for instance, if you actually have a constriction of the covering of the penis, we call them phimosis.
If that
Phimosis,
is that is if you are not circumcised, you still have your long foreskin.
yeah, and then it is
Yeah.
going to constrict. You see,
Yes.
and they found
Uh-huh.
out that men who actually are going to have phimosis have
Yes.
more chances of developing cancer of the penis. You see, so it is good
Mm-hmm.
that we are going to do what we call circumcision. Poor
Yes.
hygiene, because as I said, the
Mm-hmm.
smegma is a good breeding place for what we call HPV. Smoking, we mentioned, and we also mentioned HIV. When you
Yes.
actually have HIV, you also increase the chances of you actually getting penile cancer. But one
Mm-hmm.
of the best prevention is circumcision, okay, and good hygiene. See,
Uh,
and maybe later on in the future, then men would be allowed to get what we call this vaccine for human papilloma virus.
yes. Alex, while we are there, one of those things that we enjoy on this program is to be quite forthright and to be practically clear with our viewers so that they understand what we are talking about. When we say penal hygiene, um, what are you saying? What when I'm bathing? What how does the hygiene come in? How does one become hygienic about their penile organ?
One of the best way, because you see, when you are going to be circumcised, as you
Yes,
notice, okay, for instance, if you are not circumcised, when you retract the prepuce, you can see this white thing that is growing very well
yeah,
there. You see,
yeah,
now if you don't want to be circumcised, then you really have to clean that one, because
yes,
that is the good breeding place. You retract and then you actually clean and you wash. But one of the good things, one of the ways of what we call penile hygiene is circumcision. You see,
uh-huh.
yeah.
Okay. So what I seem to hear from you, as far as penile cancer is concerned, is if I address the smoking habit, address my lifestyle in that area, I'm actually addressing risk factors.
That's
And
true.
then
Yes,
you're also talking about circumcision when the
that's true.
foreskin is removed, and then my hygiene to my penile organ is improved than when the foreskin is there and it's harboring infection inside. That's what I'm getting from you, and also the whole issue of what do you call it, HIV, HIV, and what have you. We may need to address something like that and so forth. And then let us now go to one thing. If I before I forget, I like the idea of the Bible being confirmed in the medical science, especially as far as circumcision is concerned, and also avoiding multiple sex partners or any substances that are injurious to health. I really appreciate that. I'm sure our viewers are going to be asking more about the penile cancer. Let us go to testicular cancer. I'm sure this is cancer of the testes in the scrotum. Can you take us through that one, please?
Well, if you have actually, let me just go for the treatment, and this is
Oh,
it
for the
because
treatment. Oh,
uh,
okay, not of the renal
depending
cancer,
on
that is.
how is extensive the cancer is, and
Yes,
we have to cut the skin if it's only the skin. But if it
yes,
has got to the glans penis, we might have to actually remove part of
yes.
the penis, you see.
You remove
And
the whole thing, or the only the
depending, because
affected
you
part.
see, the doctor will find out how extensive,
Mhm.
as much as possible, we would like to conserve, you see. But
Yes,
then you see, in some places, in some cases, we really have to do complete amputation of the penis,
of the
which is
penis.
very bad for men, you see.
What am I going to do with my wife now at that point when that thing
This
is
is it.
gone? Is the marriage still there when the penis is gone?
That's why your wife should also check on you, you see, so that it is going to be intact, you see. And these are realities.
Yeah.
What is important is that they just put so that the person can still to be able to urinate, you see. And
Yes.
well, even though the penis is going to be removed or cut, which is very unfortunate, and it can be
Yes.
very
Yes. Yes.
debilitating to men, yet they
Yes.
can still have children because they can still remove the sperm from the testicle and
Oh,
be
and
able
do
to.
artificial insemination.
Yeah. Yes, yeah.
Yeah, there's a question, Alex, on the
Yeah.
on the on the chat box there, and it's from Elizabeth. And Elizabeth is saying, "Thank you for the educative discussion." And the question then is, how safe is having circumcision among the elderly? Now, look, I'm 60 years over 60 years of age. I don't know how old you are. We have other people that are 70 years, 50 years. 40 years, they're going to be hearing about the importance of circumcision and how it can prevent some of these cancers, and they want to opt to be circumcised. Is it okay, or is too late?
No, it's all right. What you do, because it is also part of good hygiene. You see,
It's
to
good
have that
idea.
one. And in fact, for HIV, one
Yes.
of the ways that you can prevent HIV is really doing circumcision. Circumcision has found out to reduce HIV by 65%
Mm,
because
mm,
of the hygiene. At the same time, the smegma there is a very good, what we call, breeding place for the CD4. You see, so
yeah.
it is no problem. In fact, I have done it in older people. The risk is actually there is no great risk. You see, if being done properly, and compared to really young boys, you see, it is in fact much better because old people, they do not move and they understand the procedure, so there is no risk at all. There is no greater risk if you have it at a young age or an
Mhm.
older age, but it is better really to have it at a young age, as the Bible has actually prescribed.
Yeah, Alex, I wish we had the whole month to be
Sure.
on studio and talk about this, but time is not in our favor. Now, let's go to testicular cancer. Take us through, please. What is that? How does it present itself? And what are the risk factors, causes, and all those things, prevention and the complications with treatment and all those things?
Okay, your testes, okay, that is where the sperm is being formed. The
Yes,
testes have two functions. One is to produce sperm so that you're able to have children, and number
yes,
two, it also produces the male hormone, which is very important, you see.
yes,
And when you are going to have cancer of the testes, then
yes,
these are going to be affected, your ability to have children, at the same time also what we call testosterone. Now,
yes,
it is very important that you also do what we call a testicular self-examination, okay?
yes,
Because testis, okay, cancer of the testicles is the most common
yes,
between ages 15 to 49.
yes.
Uh,
15 years.
15 to 49 years old, you see.
Ooh, I thought it was an old age kind of
It is
challenge?
more common actually in young persons, you see. And it
Okay.
is common, for instance, they have found out that if you're actually having, for instance, development abnormalities, they call it cryptorchidism. Like when
Yes.
a child is born, a male child is born, and the
Yes.
testis does not descend. And that's
Yes.
the problem. Because
Yes.
then, if it stays in the inguinal area or the abdomen,
Yes.
they actually become cancerous. So it's
Uh-huh.
very important for parents to check when a child is born, a male child is born, that the
Yes.
testing has actually gone down. Because if it has not gone down, then your likelihood of developing cancer is quite high compared to the general population. So the number one cause really of testicular cancer is what we call cryptorchidism.
Yes.
Cryptorchidism meaning the testis does not actually descend.
It is
Okay,
still in the abdomen there.
yes, it's an abdomen or in the inguinal area. But the good
Yes.
thing is that it can be corrected surgically, and it should
Hmm.
be corrected. Some of the surgeons say it has to be corrected before 10 years old. You see, some say 11 years old, but see your doctor, because then it is very important that the testis should really go down. Okay.
Let me hold you there, Alex, while you are still there. You are talking of young boys and their testes haven't descended in the scrotum, as it were. What about if you are, let's say, 30 years old, 40 years, and maybe my age, and you encounter some accident that pushes your testes up, and you're talking of the risk factor of testes being in the abdomen or in whatever area you're talking about. Uh, should I ask them to remove them entirely if they cannot come back to the scrotum? What should I do?
Yeah, the doctor can easily just pull it down, you see. But if it
Yes.
cannot be, then you can actually have it removed. Because depending, like for instance, if
Yes.
you have already children, then you
Yes.
say, what do I need? Of course, you would need for the hormones. But
Yes.
there is really, in an accident, normally what happens is that the testes can be crushed instead of going up.
Okay.
It is
Okay.
not very possible, that you have actually the testes, because you see, it is quite closed, you see.
Yeah. Yeah. Okay. Yes.
There is
Yeah.
not such a big opening for the testes to be able to go back into the abdomen, you see.
Okay, that's fine. The risk factors and or maybe we did not touch the element of how does it present itself with the penile cancer. You said the gland will change color, the skin will change color, and stuff like that. Now, how does the testicular cancer present itself?
Yeah, you can actually have, okay, that's why it is very important that you do what we call testicular self examination. Okay.
Yeah, you were talking
For
about that. Yes,
instance, this is your testis, okay?
yes, yes,
Example, okay? The
yes,
best way to do it is actually to do it after you have a warm bath. When you have a warm bath, what happens is that the scrotum, which is the one covering the testes,
yeah.
becomes
That
relaxed because of the warmth. When it becomes warm, then the skin actually is going to stretch, and it is easier for you to feel the what we call the testicle. So you're
yeah,
supposed, actually, if this is okay, I don't know, you're supposed to hold it in your fingers. Okay, I cannot see.
yeah,
Both your fingers, and you try to roll it, okay, wherein
yes,
your fingers
yes,
are at the back, and then the thumb are in the front, and then you try to roll, and you
yes,
feel if there are any lumps,
yes,
or a little bit slightly something like a swollen part, which is what we call the epididymis, which is normal.
yes.
When you slide it, there should be smooth, and there should
Mhm.
be no pain. You see, there should be no
Yes.
tenderness. So those are
Yeah.
the things that you are going to watch. Okay, uh,
Mhm.
there's going to be what we call pain. There's going to be swelling. There's
Yes.
going to be a lump. You feel uncomfortable, and sometimes you feel it's a little bit heavy. You see, now you have to do it when you do a testicular self-examination. You
Yeah.
have to do one and the other one. Okay, we
Yeah.
have to remember that one part of the scrotum is lower. Okay,
Uh-huh.
And also one of the scrotum, I mean, one of the testicles is also a little bit bigger, so that's normal. But
Yes.
really, very important that you also try to roll your finger to feel any lumps or
Mhm.
any swelling or any pain, you see.
Yes. Okay. Is it not possible that sometimes there is asymptomatic? You don't feel any symptoms at all, and it's there.
That's why those are the things, other things like, for instance, if you have the inguinal area, okay,
Mhm.
try to feel any lymph nodes. But if you're going to feel the inguinal nodes, that means that it has already metastasized. Uh,
Yes.
Aside from that, there are what we call, you can do ultrasound. What they do is they put an ultrasound and they can really
Mm.
see if there is anything growing, because that's actually true. In some people, you don't have any symptom at all, but then, for instance, if it gets big, then you suspect like something like heaviness, then
Yes.
you have yourself actually examined, you see. And
Yes.
some of the problems actually, okay, for instance, smoking is also associated, okay, especially
Yes.
marijuana. They found out that people who
Mm.
are actually doing marijuana have increased risk of developing what we call cancer of the testicles. And as I said,
Yes.
the age, 9 out of 10 cases are between 15 to 49. So it is
Mhm.
very important that we
Yes.
educate actually our young people to be able to differentiate and to be able to sense that they have something going on. And it's very straightforward actually. Once you actually have this testicular cancer,
Mm.
then, well, they can do what we call an orchiectomy or removal of the
Yes.
testes. Even
Okay.
though you have that, yet you have, remember, you have two testicles, so
Yeah.
you can still have children. But
Mm.
what people can also do is that when you are actually diagnosed, then they
Yes.
can get the sperm and they can cryoprecipitate it. That means that they are actually doing some uh, storage. They call it storage of that, what we call sperm. They call it
Yes.
cryo preservation, and
Yes.
that can be actually used for what we call storing the sperm, so that you would need to impregnate somebody. If you get pregnant, for, I mean, if you get a
Mm.
wife, then you can give that sperm. But it's important that you get that sperm before you do some radiotherapy, because they can also do what we call radiotherapy, meaning X-rays, you see, or
Yes.
doing chemical, what we call chemotherapy, so that the
Mm.
quality of the sperm is not compromised. Yeah.
Right. Let's go to this point. I want to go back to the presentation of the actual cancer itself. Now the cancer is there, it's advanced. What is happening on my testes? What is happening to the scrotum? Is it going to rip open the scrotum? Is it, or is it only localized in the testes? Um, how what is happening to me if I've got this testicular cancer?
If it is only if it is caught early, then it does not. But the problem there is that if you are not going to address this cancer of the testicles, then
Yes,
it is going to spread. And once it spreads into the skin, because the skin is the nearest one, okay,
yes,
the nearest one, that's the time that you're going to have ulcerations. When you're going to have ulcerations of the scrotum, then that
yes.
is already a sign that it has already gone out from the testis itself.
Oh, okay. And then again, if you have said this, it's okay. It's good for repetition. Um, is this kind of cancer preventable? What can I do to prevent it coming to me? Like you're talking of the penile cancer, we can do circumcision. I need to make sure I address my lifestyle against certain substances and multiple sex partners and stuff like that, and the hygiene. Now, when it comes to testicular cancer, what precautions do I take and what prevention do I do?
Okay, there's also what we call testicular cancer when you are doing occupations, you see. Like, for
Yes,
instance, this was quite common in the past, wherein you had chimney sweepers. You know, the
Yes.
chimney needs to be clean, and they clean that one. And
Yes.
because the what we call the chemicals of the smoke rub into the testicles, then there is an increased chance of developing what we call cancer of the testes. Also,
Mhm.
those who are involved in pesticides, you see,
In
that can
pesticides, yes.
actually increase. Yes, gas
Yes.
workers, for instance, they
Yes.
also have an increase. So, if you are in those professions, then you might need to have what we call regular testicular checkup. You see,
Check up here.
yeah. And okay, as I said, a big part is developed because of undescended testes. So it
Yes.
is very important that if there is undescended testes, then you are supposed to correct it surgically to have it done. You see, and
Mhm.
then also, for instance, HIV infection also increases
Yeah.
your risk
Yeah.
factors for developing what we call testicular cancers.
Yeah.
And if a man has actually infertility problems, okay,
Yeah.
number one, if the sperm is low, number two, if the
Mhm.
sperm is what we call abnormal in shape and
Yes.
also very poor motility,
Yes.
you also have an increased risk of developing testicular cancer if you have what we call infertility problems, you see.
Okay. I will ask you to hold there for a sec. There was a question that from Penmuaja there. If our IT can bring that question, let us see if we can answer that question. Thank you very much, IT guys. The question says, thank you for this rare topic, especially amongst men, and bravery for saying it as it is. How can men, youth be uh, encouraged to be screened for cancer circumcision without being stigmatized?
Yeah, this
Let's
is
deal
the
with the
reason.
issue of stigma and circumcision, stigma and cancer screening.
This is the reason why we have programs like this to educate the public, because
Yes,
you see a lot of misconceptions, and
yes,
so many are ignorant about what is happening. I actually tell them, you might as well suffer some what we call a little bit of embarrassment, when you're going to go, because they're embarrassed to go to the
yes,
doctor,
yes.
than being diagnosed later on and you're going to die,
You
because
see,
whatever is going to happen, like for instance testicular cancer or penile cancer,
yes,
uh, if you are not going to correct this can also metastasize. It
okay. Oh, it
metastasizes
does,
in,
it does.
yes, all of these cancers, as I said, that is the characteristic of cancers.
Yeah, let me
they
hold you up.
spread they
Yeah,
spread to other places.
yes, thanks,
And now,
thanks.
for instance, if you're
Thank
going to
you.
metastasize to the bladder, that means you're going to have difficulty in passing out urine. Not only that, but we doctors have a way of bypassing the bladder so that you can pass out urine in some other ways, you see.
Yeah,
Not only that, but it can go into the bones. And then from the
okay.
bones, it can actually go into the chest. It can go into the
Yeah,
lungs, you see.
yeah,
So
yeah,
we keep on encouraging you, you see, that which is better, that you are going to a little bit be embarrassed, that's part of it, or a little bit
yeah,
ashamed,
yeah,
or a little bit inconvenienced, and you can
yeah,
save your life, or you are going to die to of something that can be highly
mm,
preventable, you see.
yeah. Okay, thanks. I wanted to hold you there because I saw this person sending their question. It was appearing twice here for the second time, and it's from Google Letu. And Google Letu is saying, can a man get cancer because of an STI,
uh,
sexually transmitted infection?
we actually mentioned to you that papilloma virus, okay?
Yes,
Now,
yes.
we have to realize that human papilloma virus is transmitted mainly because of sex.
Hmm. Hmm.
And because the sex right now, they have actually what we call improvised sex. They even do sex by the mouth.
Hmm.
And people actually have cancer of the mouth, because of sex. Not only that, but also anal sex. You see,
Yeah,
unfortunately, I
anal sex, yes.
we don't want to be so vulgar about it, but we have to be straightforward.
Straightforward. We need to
That
be clear. Yeah.
we have
That,
to tell you, you see, that a cancer of the throat can be because of drinking too, you see,
yes.
drinking or smoking. but also because of what we call oral sex. You see,
Mm.
the cancer that is in the cervix can go
Yes.
into your mouth. You see?
Ooh, yes.
So
Now,
STIs, it's true. So what are the STIs that can cause cancer? Cancer of the cervix, okay? Cancer of the vulva, actually, because it's also human papillomavirus. Cancer of the mouth, cancer of the throat. Not only
yes.
that, but cancer of the liver.
Yes.
Hepatitis B is actually a sexually transmitted disease. So
Oh,
that's why
that's
God
so.
actually was very, very direct and say, one way that you can keep yourself healthy is to really follow the seventh commandment.
Mm.
Thou shalt not commit adultery, because the more you're going to have partners, the more is your chance of getting this virus, which can cause cancer. Kaposi sarcoma also, which is also a cancer of the lymph node or cancer of the blood vessel, is
Yes.
also sexually transmitted. So, in
Mm.
short, do you get actually cancer through sexually transmitted infection? Yes.
Yes. Thank you, Google, for asking that question. I want to now transit to the next cancer, which is prostate cancer. And before we go there, let me see if this is a question. Okay. It's not a question, it's just a comment. I don't know that this is an observation, or maybe you may want to advise our viewers out there. People who are carrying the did you say papilloma, human papilloma virus, HPV? Is there any way of telling I am infectious? Is there a way of telling? Now you sleep with this woman. Is there a way of telling she has, she does not have, you have, you don't have? I'm trying to buttress the importance of sticking to one sexual partner as a hygiene principle, not only as a hygiene principle and also as a preventive principle and whatever, because it's not always given that the person you are sleeping with, and especially I'm going to further ask the question: if I'm using condoms, am I extremely safe against the HPV virus? Um,
Okay, let me answer first the condom. The
yeah.
condoms do not give 100%. It helps, but it does not prevent, because you see, HPV can also be just also in your inguinal area. It is not
Mhm.
only in your what we call organ, it could also be in your skin, you see.
Yes.
Now, condoms help, but it is not 100%, okay?
Mhm.
Now, about what we call this HPV, how do you know that you have HPV? You can actually do a test. Not all HPV can actually cause cancers, okay?
Mhm. Yeah.
Uh, HPV 16 and 18, and there's still two other for cervical cancer. They are the ones that can probably cause what we call penile cancer and also cervical
Yes.
cancer. Now, for instance, okay, you can actually get yourself tested, okay,
Mm.
but it does not necessarily mean that you can actually get infected. But remember that it is there, okay?
Yes.
That depends also on your immunity, because there are many people, like for instance, when it comes to HPV,
Yes.
okay, men can actually give the HPV to a woman and yet they don't get the disease.
Oh, okay. Okay.
I know of a pastor, okay? I know a
Mhm.
pastor, personally know the pastor.
Yes.
Now, uh, honest, true, faithful pastor.
Yeah. Mhm.
And so the wife died of HPV. The wife died of cervical
HPV.
cancer. So now
Yes.
you say, where did the wife get that cervical cancer? Wherein she
Mm.
was only sleeping with the pastor, nobody else. And this
Yes.
is it, because you see, the man can actually have HPV and give it to the wife, and the
Yes.
wife can get it. Why? Is because the male organ has actually a thicker skin. In
Yes.
medicine, we call them squamous cell covering.
Mhm.
You know what is squamous cell, because it is just like the covering of your hand, okay? That's squamous,
Yes.
okay?
Yes.
But in order for you to know what is squamous, you touch your nose, okay? You just
Yes.
touch your nose, okay? You notice that
Yes.
it is hard,
Yes.
okay? Now you
Yes.
touch your lips.
Yeah.
How do you
Uh,
feel? There's a big
very
difference.
good. Yeah.
And this is it because the men's organ is actually covered with a lining similar to the nose, which is hard.
Oh, okay. Okay.
Whereas the
Good to
cervix of
know.
the woman, especially as you go higher, is
Mm.
covered by what we call columnar cell, which is soft.
Yes.
And as a result, you might have it, and
Yes.
yet you don't get the disease, but then you give the virus to your wife.
Mm. I'm sure this is why it is very important for women and wives in general to be listening to this program because we can cross infect each other unknowingly and what have
Yeah.
you.
So, but since women are liable to develop what we call cervical cancer because of that structure of their
Yes.
cervix, okay, especially the upper part of the cervix, that's the
Yes.
reason why we encourage all women to undergo cervical, what we call screening called pap smear, Papa Nicolau smear.
Yes.
Pap smear is very important, you see?
And again, Alex, I just you were saying the pastor was she was married to a faithful pastor. Don't take that for granted. Only God knows who is faithful, and but let's not comment over that. Let's
From
let's
my
go.
observation, you see, from
Let's
my,
go to
what I'm saying is
prostate.
that my personal observation of him, you see,
Yeah.
that's why I'm making that comment. But you're actually right, you see.
Yeah, no, some value judgments are best left with God, and I'm sure there are a lot of pastors' wives who are suffering because of unfaithful pastors. And Lord have mercy. May we pray that our pastors may be very faithful in that
Well,
regard.
it's good
Every
to hear
one of
from,
us pastors.
it's good to hear that from a pastor.
Yeah, no. We used to have some guy at college when I was at college at Solusi, and the guy would say he was a farm worker. Say a pastor is a people also. They sin, and we used to laugh over that. And I'm sure if Pastor Solomon Maposa is listening, and I'm sure he should be laughing right now. A pastor is a people also.
Yeah.
Anyway,
Let's
let's
just
go
go back to the cancer, okay? Because the thing is that that's the reason why you see that you actually have more cervical cancer, and cervical cancer is the number one cause of cancer here in South Africa and whole of Africa. It's
Yes.
because of the anatomy, or
Yes.
else men also would have the same number of penile cancer.
Exactly. Yeah.
But because of the structure of the male organ, that's the reason why they are relatively what we call immune to it, or they're not susceptible to it.
Yes. This is a social platform meant to strengthen families and marriages and the relationships. And I would like to appeal to all husbands, and not only husbands, and to all men out there who are sexually active. Let us do our part to protect women, and of course, women on the same wave would also need to do their best to protect one another. And I appreciate that when we observe the rules as given by God, there's a lot of prevention to suffering that can come just by obeying the 10 commandments. These are 10 steps of life. They're not just the thou shalt not, thou shalt not. These are statements of life. If we follow them, we can enjoy good life. Now, in the remaining time, let's look at prostate cancer. Prostate cancer. What beast is that, and how prevalent is it? How common is it? How does it present itself? And let's. What's your take on prostate cancer?
Okay, one of the most common cancers in men is actually prostate cancer. And here in South Africa, the statistics is 1 out of 19 persons,
Yeah.
men, are going to have cancer of the prostate. Can you imagine? 1 out of 19.
Uh-huh.
So that's quite a high ratio, you see. Breast cancer is 1 out of 9 for women here in South Africa. But
Yes.
prostate cancer is 1 out of 19. So if there are 19 men in the room,
Yes.
you can be sure that one is to have prostate cancer. And the thing is that it is so lamentable because it is what we call highly preventable.
Mm.
And unfortunately, if you actually get prostate cancer at a young age, the prognosis is actually very bad compared to if you get it at a later stage.
At
For
the
instance,
later
if
stage.
a person gets it at 35 years old, his likely
Mm.
chance of survival is actually lesser compared to a man who gets prostate cancer at the age of 50 years old.
Mm.
And
Mm.
they did a study and they found
Yes.
out that there were men who died of other causes because
Yes.
we usually think that prostate cancer is only happening in men above 45 years old or 50
Yes.
years old.
This is what
So,
we've been told, that after 40 years of age you need to watch out, and I'm surprised that you it can even happen earlier than that.
and this is it. And the earlier it is, the worst is the prognosis. I mean, it's bad if it is
Yeah.
actually earlier. If
Yes.
it is found at a later stage, the survival is much better. So,
Mm.
anyway, they did a study in America and
Yes.
they actually what we call studied the prostate of men who died of a
Yes.
different cause. Like, for
Mm.
instance, they died in a car accident, or
Yes.
maybe they died because of a gunshot, okay, or maybe
Yes.
heart attack. They did not
Yes.
die of it. And they examined the prostate and they
Mm.
found out that as early as 35 years old or 30 years old, people
Yes.
were already having signs and symptoms of prostate cancer, you see.
Yes.
So it's
Oh,
very
oh,
important. And so what is done is doing a blood test, and this is good because this one you do a blood test. It's called prostate specific antigen or PSA. What happens
PSA.
is
Yes.
that, yeah,
Yes.
the cancer cells are going to produce this protein so
Yes.
that when the cancer cells are actually going to multiply, then they produce more of PSA. The
Yes.
normal is 0 to 4. Okay.
Yes.
If it is
Mm.
above 4 to 10, that means you have
Yes.
to be very careful. That means that maybe 4 to 10, the cancer is already starting. Okay. But
Mm.
if it is above 30, for instance, that means it has already gone outside of the prostate. Now, first of all, let me explain what is the prostate. Okay. I don't know
Yeah.
you
I was going to ask that. Yeah. Thanks a lot.
whether you know where your prostate is. Man, do you know where your prostate is? It's actually located inside, you see. It is located inside. It cannot be seen. It is not like the testes and the penis that you can see, but the prostate is inside. Now, the
Yeah.
function of the prostate, it is like a walnut, okay, a walnut,
Mm.
those nuts
Mm. Mm.
size, okay. The
Yes.
function there is to actually produce some secretion so that when you ejaculate, you have some, the sperm is being produced
The
by
semen.
the
Yes.
testes, okay, and then it has to have some fluid in it, which is being
Yes.
produced by the prostate and what we call seminal vesicle. You see, now
Yes.
the vagina has actually what we call an acidic secretion, but
Mhm.
then the prostate is going to secrete something alkaline to neutralize the acid so that it is
Yeah.
easier for the sperm to be able to
Yes.
problems, can cause a lot of problems in men. It might be small. So one
Yes.
of the best things that we can actually do is that, for instance, if you reach 40 years old, then
Yes.
we advise you, especially if you have actually a sister who has breast cancer, or your
Yes.
father, or your brother, for instance,
Mhm.
your father, and then your brother is having prostate cancer, then you
Yes.
have to have yourself tested
Yes.
because it is genetic.
It's
40 years
genetic.
old is a cut line. For those who are actually suspected, there is
Yes.
what we call a gene called BRCA1 and 2. Okay.
Yes.
Now, this is technical, but if you have that gene BRCA1 and
Yes.
2,
Mhm.
you are liable to develop what we call prostate cancer.
Answer yes.
So, if, for instance, if you have a first degree relative, that is the father,
Yes.
that is also your brother, for instance,
Mhm.
okay, then you should do a PSA at 40 years old. And
Yes.
then do also a digital rectal exam. The doctor
Mhm.
is going to insert his finger so that there
It's
will not be any
finger.
growth at all, you see.
Yes.
So, and every year you should do those tests because you are liable. But if you don't have that gene, or you don't have any what we call history of prostate cancer in your
The family.
family, then you should do it at 45 years old. It used to
Mm.
be 50 years old, but now they have lowered it to 45 because, as I had told you, they have found out that it is actually occurring even in younger age, you see.
In
So
young ages.
one of the things that you can do is do what we call prostate specific antigen. Okay. Now,
Yes.
there are also what we call risk factors. They found out
Mm.
that people who eat a lot of red meat, especially with fat and especially
Yeah.
dairy products, have an
Mm.
increased
Yeah.
risk factor for
Mm.
prostate cancer.
Yes.
Alcohol consumption also increases.
It
You know,
does. Okay.
as Adventists, we believe that we should not be taking alcohol, but in the world, they said, well, you just drink moderate, but our stand is do not drink any alcohol at all. See, but
It will help.
high alcohol intake, you see. Uh, Also, the use of tobacco products have also been associated with an increased risk of what we call
Yes.
prostate cancer.
Yes.
Okay,
Yes.
insufficient consumption of fruits and vegetables
Yes.
that also leads to what we call increased risk factors for prostate cancer. Okay.
Okay.
Also, the use of what we call anabolic steroids. We know that some people, some athletes are using steroids to be able to get good muscles. That
Muscles and
also
yeah.
increases your chances of developing what we call prostate cancer. Okay.
Mhm.
It is quite common, especially in African Americans, blacks.
Yeah.
Unfortunately, this is known. So they have found out that it's more genetic, you see.
Mhm.
So, for instance, if you have a mother or you have a sister who actually develops breast cancer, the
Yes.
likelihood that you are actually BRCA positive is also there. That means you are at risk of developing prostate cancer.
You are touching something. I wanted to make a follow up earlier on, and I'm glad you have brought it up again. This family history of breast cancer in the family, my sister, my aunt, my grandmother, or whoever in the family had breast cancer and whatever. Why is it necessarily connected to prostate cancer?
Yeah,
To
because you see, these are what we call genetic mutations. This
Yes,
gene you actually inherit, you see,
or you
and as
inherit
a
it.
result, then you get liable because, in a way, they are connected, breast and also the prostate.
Okay, no, that's fine. Alex, let's go to um, how do I know as a man? Okay, let's answer that question first, and then I will ask you my question. This is from Joy Makombe, and she's saying, "Thank you for this good, innovative, informative topic. Do men also have breast cancer? How would it present itself on the men's chest? We should also promote October for men's cancer as well." I'm glad Joy is bringing that one up. When we go to cancer promotion in October, it's like it's just women that we are focusing on, and yet men. I don't know. Do men get breast cancer? Maybe in 1 or 2 minutes, let's address breast cancer. Then we go back to prostate cancer.
Yeah, that's also true. That's also a misnomer because men think that it's only in women, but breast cancer is in men because it is the same anatomy as a woman, and that's
Yes.
the reason why that BRCA, if it is in your sister or in a mother, you can have it, and you can have prostate cancer, and you
Yes.
can have also breast cancer. And the
Mhm.
thing is that the breast cancer in men is actually even more dangerous because they can grow faster and they can be more what we call lethal compared to women. And thank you so much, Joy, for coming up with that suggestion. Yeah, October is actually breast cancer month, and that's the reason why women are encouraged to wear that pink ribbon
Mhm.
denoting what we call breast cancer to make women aware. As I had mentioned earlier, it is very common in women here in South Africa.
Mhm.
1 out of 9 women are going to develop breast cancer.
Is
Now,
is 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 that true, Alex? One
yes,
in nine.
1 in 9 in South Africa.
Hey.
Let's be serious. Before HIV, the most common cancer here in South Africa was breast cancer. But because of HIV, and when you have HIV, you increase your risk of developing cervical cancer. So right now,
Mhm.
cervical cancer is the highest because of HIV.
Because of HIV, yes.
Yeah. But breast
Okay.
cancer is second. And it would be also a good way. The problem is that there are no drivers for
Mhm.
men to do what we call promotion for breast cancer for men. But really, it is very important that it should not only be women who should be aware, but also men, you see. And the
Yes.
same symptoms, like for instance, a lump, if not the breast becomes a little bit bigger or a little bit
Yeah.
tender, those are the things. And as I said, when you have actually cancer of the breast in men, it is more dangerous compared to women.
Okay. I just want to go to early signs, because if this is a very common cancer, let us help our men to have an idea of what's happening, for them to be able to say, I think I need to see a doctor here, or I should be worried here. I remember back then, when I was a young pastor, we had this elderly pastor that drove with us a long stretch, and after every 20 kilometers, if
Yeah.
not 30 or so, the car stops, he goes out, he comes back, we drive, he stops, and then he says, hey, wait until you are also old. There's this thing called the prostate, and what have you. What has prostate to do with urine frequency? Is that a warning sign? Should I be bothered when I go to the toilet? I'm struggling to pee, and how do
Okay.
I know I'm developing prostate cancer, or my
What?
prostate is
Yeah.
becoming a challenge?
One of the symptoms is really frequent urination. Okay, as
Mhm.
what you have
Yeah.
illustrated with your pastor, but it
Yes.
does not necessarily mean that it is actually prostate cancer. Anything that
Okay.
causes enlargement of the
Of the
prostate
prostate.
will
Yeah.
actually cause you to have increase in frequency of urination. The
Mhm.
reason for that is because the prostate gland is located in the neck or the outlet of the bladder. See, before
Yes.
the urine is going to go out, there's a neck where it passes to, and that
Yeah.
is where the prostate is located. Now, when the prostate is going to become big, okay,
Yeah.
then it is going to press on the bladder. And as a result, you want to keep on going to the bathroom
Yeah.
to be able to relieve yourself. So that doesn't necessarily mean that you have frequent urination, that it is prostate cancer. It could just mean what we call benign prostatic
Mhm.
hypertrophy. That means
Yes.
that the prostate is enlarged. But really, it is very important to come out and to check, because that could just be the early sign. You can also have what we call erectile dysfunction. That means you're not able to have a good erection. You keep on
Mhm.
urinating at night. You can have what we call also blood in the semen, you see,
Yeah.
and you can
Mhm.
have also what we call dysuria or difficult passing out urine. These are the
Mhm.
ones that are actually painful ejaculation and sometimes swelling of the inguinal areas. These are what we call some of the signs that indicate prostate. To me, the most common is really frequency of passing urine. That is one of the earliest signs of what we call prostate enlargement. And hopefully, the enlargement is just benign. That means it's not cancerous. But if it's cancerous, then they can immediately be what we call uh, dealt with. But what is important is that men should have at least one PSA examination, because sometimes these symptoms do not appear until it is late, whereas the prostate specific antigen would be able to pick up when it
Mhm.
is early. And of course, you go to the doctor, and the doctor is going to insert his finger into the rectum, and he's going to feel your prostate, because normally the prostate is what we call rubbery and is smooth, but when he inserts the finger, it becomes hard and there are some nodules. Then that is very strong suspicion that it is really cancerous, and especially if he feels some nodes that are there, you see. Unfortunately, men are afraid to go to the doctors to have the finger inserted into the rectum to find out.
Mhm.
But I tell you, it is very important that we should do that one in order to save lives, you see.
Yes.
Because so many people have lost their life. You see? Let me just.
Yeah. Alex, I don't know whether this is allowed in the social media, but I just want to salute the organization that I work for, the Seventh Day Adventist Church, especially at administrative levels, where we have a policy in the church for all our pastors, church workers, that you need to go for medical checkup, and it's even funded by the church. And then you go there, and your GP tells you, I think we need to look at that. Your PSA is slightly higher, and I would like to refer you to a specialist so that this can be looked at. And I love the Adventist Church because it has redeemed quite a number of workers with what you were calling early diagnosis. It appears mandatory. It's like they are forcing me to do it, but they're actually saving your life. And I also equally, and I don't think it's only the Seventh-day Adventist Church that does that. I want to think that there are many corporates and many other denominations and religions that are very particular in terms of taking care of the health of their workers and their family members and what have you. Is there anything around the prostate that you want to say? Otherwise, we want to wind up now. Anything around the prostate that you think this people should know about this? As far as
Okay,
prostate is
that's
concerned?
why it's very important. Okay, it's very important to have an early diagnosis so that it is going to prevent complications and
Yes,
pain and even death, because you see, the prostate is very near the bladder. And
yeah,
so the first organ that is going to be affected is going to be your bladder. That means you're going to have different. I know of one patient because of his prostate cancer. So they had to put, and it has already spread into the bladder. So they
yes.
had to improvise a bladder for him. Not only that, but his urine, he has to be wearing a bag all the time,
All
and the
the
bag
time.
was strapped in his legs, you see, to be able
Yes,
to drain out the urine, you see. And that could
yes,
have been prevented if it came at an early stage, you see. And number two, it can go into your spinal cord. When it goes
yes.
into your spinal cord, it can be very painful.
Mm.
And not only that, but it can go from the spinal cord, it can go into your lungs, it can go into your liver,
And
and
it
that
can go
becomes very
everywhere.
difficult, you see. Whereas if you are going to be caught on an early stage, then the doctors can do surgery. If not, they can do what we call radiotherapy. There is in Loma Linda, they call it the proton beam accelerator, wherein
Yes.
they actually shoot several beams and to hit the
Mhm.
prostate so that it is going to shrink. So these
Yes.
days there are many modalities that can actually help. But what is important is that to have an early diagnosis so that it would prevent complications like metastasis. And if it
Mhm.
is found early, I know that some men would say, I know if I'm going to do a prostate resection, then it is going to affect my sexual life. And that is true.
Mhm.
That is
Yes.
really true. For instance, if your prostate is going to be removed, then it is going to disturb your ability to have what we call ejaculation, because
Mhm.
the prostate is going to be removed. In fact, the
Yes.
orgasm, they call it now a dry orgasm because nothing comes out. Okay.
Mhm.
But for the erection, uh, sometimes it does not return. But as
Mhm.
long as the doctor is careful, then the nerve can be spared that you still are going to have an erection. So
Mhm.
very important, really have yourself tested PSA, prostate
Yes.
specific antigen. Okay.
Okay. No, that's fine. Doctor, any word as far as I know we've touched on breast cancer already. Do you want to say something about lung cancers in another 1 or 2 minutes, and then we can wind up? If,
Yeah,
for
unfortunately,
our IT guys, if there's a question, you can now throw it. Our last question. Otherwise, we are winding up now.
okay. Now, lung cancer is the number one cause of cancer in men. And the reason for lung cancer is because of smoking. Okay.
Mm.
But although smoking is number one, yet we have to also realize pollution because of pollution. I know of
Yes.
several Seventh-day Adventists who developed lung cancer and they were not smoking. Okay.
Yes.
But this is it because we're living in a sinful world. But really, in the end, what is important is that we try to prevent and we try to do all the possible measures that would help so that we are not going to get cancer. And they
Mm.
found out several factors that actually can decrease your chances of getting cancer. Number
Mm.
one, eat a lot of fruits and vegetables. They found out that fruits and vegetables actually have what we call these phytochemicals which would fight actually cancer, especially like for instance in the case of prostate cancer. They
Yes.
found out that by eating cruciferous
Mm.
vegetables like broccoli and cabbages, that would
Mm.
also help to prevent. Number two, uh, tomatoes. Tomatoes have a substance called lycopene, which would
Yes.
also help prevent the development of prostate cancer.
Mm.
So the
Yes.
more the plant-based diet that we have, the
Okay.
better is the outcome for cancer. Number two, okay, alcohol consumption. We are Seventh-day Adventists, and I believe in that. We should not be taking alcohol. But the world said, okay, moderate. But even moderate has
Mm.
been shown to actually increase the chances of developing cancer. So
Mm.
really, the best level for alcohol is not to drink any alcohol at all. The
Oh,
body
yeah.
does not need any alcohol at all. Number three, also smoking. You see, smoking
Mm.
too. The number one preventable factor in many diseases is really smoking, whether
Yes.
it is cancer, whether it is cardiovascular diseases, and many others. And number four, it is very important that
Mm.
we exercise. When we
Yes.
exercise, okay, it is going to help build our immunity. In
Mm.
fact, they found out that the new smoking is when you just keep on sitting in your chair. If you're not smoking, but you just keep on sitting, it is actually bad because it increases your liability of getting cancer. The best thing is after 1 hour, go around. In fact, that is what they're doing in the General Conference Office. In the
Mhm.
General Conference Office, every hour, they play a music and they actually remind people to at least get out of their desk. You see?
What is general conference? Is that in Russia or in China or Japan? What is that thing?
That is the headquarters of the Seventh-day Adventist Church, you
Oh,
see?
okay. Okay. Yes. Thank you.
And you go to the general conference, you'll find out every hour they have actually a reminder. And number
Yes.
five, keep to your ideal body weight because the more fats you have in your body, the more
Yes.
chances that you are going to develop cancer. Okay?
Mm.
Lifestyle, very important. Okay.
Yeah.
God has
Okay.
made all of this so that we are healthy. Okay.
No, no. Thanks, Alex, and thank you for the contribution you have made tonight. Man, it's powerful. I think I'm the first student. I'm your first student. I've learned quite a lot. But in just one line, uh, in just one line, are there risks involved with biopsy when doctors want the PSA is high? Now they want to confirm that with biopsy. And suppose you're already cancer is developing in the what in the prostate. If they start cutting and taking pieces of flesh from it of tissue, doesn't that aggravate, or are there other risks involved with the biopsy?
It is true because you see the biopsy, once you actually are going to open, then the liability of the cancer cells going into the other places can also occur. But that is not so much the problem. The reason why we do a biopsy, though, Number one is to confirm, and also so that we would know what type of treatment to give you.
To give, yeah.
You know, it's
It's
cancer is
necessary.
different. There is the risk, a biopsy, because some people even have, died because, like, for instance, I know of a friend who died because they did a biopsy and then it was bleeding. That can happen, you see. But the thing is that the risk involved is lesser compared to if you do not know what you're dealing with. Like,
Okay.
you are not going
Okay.
to have the exact diagnosis because, like, for instance, if you are going to do a biopsy in the liver, is it cancerous or is it maybe tuberculosis? If it's
Mhm.
tuberculosis, then it can be treated. And if it's cancer of the liver, then we can actually know because, cancers, there are different types of cancers. That's why
Yes.
we have to be specific. And that's the reason why we have to have biopsy. There are risks involved, but the risks are actually justified. And the chances of your survival is much better when you do actually a biopsy. So we would know because there are actually many curable causes aside from cancer, you see. And if it is a curable cause, then you did not do a biopsy, then you have missed the whole thing, you see.
Yes. Doc, if there is anybody who wants to have a follow up to this cancers we have discussed and they want to get in touch with you, is it okay for them to phone you or to get in touch? How would they get in touch with you? Or that's not your area? I'm
That's
sure
okay.
somebody may not have asked a question here, but they really and to go to a medical specialist, maybe they don't have a medical aid to do that. But now here's a missionary doctor. Are you willing to provide information to somebody who needs information? And if
Yeah,
so,
that's
how
the
do they
reason.
get hold of you?
Yeah, that's the reason why we are here, you see, so that we'll be able to help. And this is the beauty of the Seventh-day Adventist Church, is because
Yes,
we have
yes,
really this health program to be able to help the church, not only that, but also to the community. And
yes.
that's it. You can get in touch with me with my email. That is liagunoa@gc.adventist.org. Maybe they can flash that. If not, they can actually get in touch with me with my cell 082 657 7547. That's also my WhatsApp. So it's okay. Yeah, we are there to help.
Very good. And if you have not gotten the contacts, you can also inbox at Let's Talk with Pastor Ngwaru Facebook page. You can also text to Let's Talk with Pastor Ngwaru YouTube channel. And oh, there you are. There you are. They is scrolling on the screen there. Our contact details. Would really appreciate that. Please get in touch with us. I can direct you to where you can get the doctor. Appreciate that. Dr. Laguno, thank you very much, Alex, for the time you have spent on the program. I know this was your second appearance on the program, and obviously this is not your last because we still need to talk about women and their cancers as well, and I'm sure they also deserve to have attention. And in the near future, we are going to be calling you and what have you. Please be ready to be invited anytime. I know your willingness is over there. And to you viewers, we are also happy that you could be with us. It's not been a short time. We have gone for an hour and so, and you've been listening and whatever. We want to thank you for your willingness to learn. And this is exactly why we said our vision on Let's Talk with Pastor Ngwaru show is to come up with a channel of choice for human development and across the board. And for you to also help us grow this channel. If you are listening tonight and you have not yet subscribed to our YouTube channel, we would like to request you to do so now as we sign up. Please remember to subscribe. Let's get bigger together. We want to touch many people. We want to produce many programs. Your subscription is going to help a great deal. And you can also like our Facebook page, Let's Talk with Pastor Ngwaru. I would love that. And others can follow us on my YouTube profile, which is Michael Rugube Ngwaru. Thank you. Thank you for your time, Doctor. Thank you for your time, our listeners and viewers there, and for the men behind and women behind the scenes, our technical team. We are also thankful that you could be with us right through the way. God bless you all. Dr. Aguno, after the broadcast is over, would like to remain and just gossip a little bit. Don't just disappear. I would still want you around. But otherwise, to everyone else, good night.
Okay.
See
Good night.
you next Thursday at 7 p.m. Next Thursday at 7 p.m. I have another guest or guest. You have no idea what the next Thursday is bringing. Otherwise, good night and God bless. Thank you.
Okay. Good night. Okay.
Thanks, Alex.